Thank you very much.
Good morning. Good morning again. Okay. So this today we'll be talking about importance of hospital quality accreditation. So I was asked to give this lecture. Okay, with the following prescribed learning objectives. Number one, understand the importance and value of adhering to quality control standards when it comes to managing the hospital and its different departments and services. Number two, discuss the philosophy, objectives, structure, staffing, um, policies, systems, and methods of hospital quality accreditations. Number three, develop the ability to pinpoint and isolate management and administrative problems in hospital quality control program and offer relevant solutions. And number four, last objective will be to draft a hospital management quality management system framework patterned after ISO 9001 2015 framework that can be used as a guide for developing a hospital-wide governance and operations manual. So let's start with the first learning outcomes, which is to understand the importance and value of adhering to quality control standards when it comes to managing hospital and its different department and services. A client patient tends to go to a particular hospital because of known quality services in the hospital. A physician client, there are two types of clients for a hospital, a patient client as well as physician client. Okay. So a physician client also tends to send his or her patients to a particular hospital because of known quality services in this hospital. A hospital wants to attract both patient clients and physician clients to its hospital through its quality services. So these three primordial realities and practices constitute the first general driving force why a hospital and its departments and services should promote and offer quality services to its clients. Promoting and offering quality services to patient clients and physician clients should be part of the business development program of the hospital and its departments and services in attaining financial viability and sustainability. And the hospital and all its departments and services should have a quality management system in place as part of its business development program. The quality management system includes defining first the quality expectation of patient clients and physician clients, then finding ways on how to meet these expectations. After the quality management system has been developed, it should be institutionalized by continually doing quality control, meaning continually fulfilling the requirements of the clients and documenting it on a manual that contains the quality control standards which all staff of the hospital, department, and services should know, adhere to, and make decisions according to these standards. Aside from making patient clients and physician clients experience and appreciate the quality services, the hospital can go for external or outside accreditation not only to have affirmation and validation of its quality management system, but to utilize external accreditation for marketing. Thus, the importance and value of adhering to quality control standards when it comes to managing the hospital and its different departments and services are to attract patient clients and physician clients to utilize the services of the hospital because of the reputation of quality services that results from adherence to quality control standards. Let's now go to the second learning outcomes. Discuss the philosophy, objectives, structure, staffing, policies, systems, and methods of hospital quality accreditation. Here I will be in the philosophy for the hospital quality accreditation. I'll be presenting theories and ideas, information on hospital quality accreditation as being practiced in the Philippines, and my personal thoughts, perceptions, opinions, and recommendations on hospital quality accreditation. I'm not privy to the quality accreditation system of other other countries, but probably you can share some of them to us later on for those in the for the international students in the group. So first of all, what is the difference between hospital licensure and hospital accreditation? Hospital licensure means obtaining an official and legal permit to operate a hospital from the Department of Health or Ministry of Health. A permit is granted after the hospital fulfills certain minimum requirements imposed by the Department of Health or Ministry of Health. These requirements usually include those that ensure structural and operational safety and human resource, among other things. Furthermore, they may include imposition of the presence of a quality management system, which is commonly required nowadays. Hospital accreditation is operationally defined as the processes by which a hospital voluntarily applies for recognition or attestation of compliance to a certain set of standards by a third party. The standards may be anything that the hospital wants to have an external recognition of compliance and wants to use it for business development purpose. The standards may be hospital management system, quality management system, environmental management system, disaster response, recovery, and business continuity, etc. Thus, the main difference between hospital licensure and hospital accreditation is the required legal permit to operate. This is for licensure, permit to operate, and for accreditation, the voluntary seeking for recognition of or attestation of compliance to certain standards to be used for business development. So that's the main difference between hospital licensure and hospital accreditation. And what is the difference between hospital accreditation and hospital quality accreditation? There may be a difference, or there may loosely mean the same thing. In the strictest sense, they are different. Hospital accreditation is the process by which a hospital voluntarily applies for recognition or attestation of compliance with certain set of standards by a third party. Here, there is no standards specified, whereas hospital quality accreditation, the standards sought for the accreditation is the quality management system standards. As I mentioned earlier, hospital accreditation and hospital quality accreditation may loosely mean the same thing. Although there are various sets or subsets of standards to be assessed or accredited with, such as the generic quality management system, quality healthcare and patient safety management system, human resource management system, environment management system, emergency and disaster management system. All of these subsets may loosely be called quality management system or different subsets of quality management systems. If this is the case, then hospital accreditation and hospital quality accreditation may be the same. One just have to qualify the definition of terms to be used. To further amplify on the use of the two terms, let me introduce ISO and its working on certification of standards. ISO is the acronym for International Organization for Standardization. It is headquartered in Switzerland. It is the most popular and respected worldwide organization that works on standardization of things, practically everything. It defines rules and standards to aid in the task for virtually all products and services that people use, including rules and standards about how products and services are made and to be done, and how quality control tests should be performed. ISO has about 300 standards that organizations can seek certification from. Some examples of ISO standards which are identified by numbers, example, ISO 9001 is quality management, ISO IEC 27000, information security management system, ISO 14000, environmental management, ISO 31000, 2008 version, when you have a hyphen and then you have a colon and then a date, a year date, then that's the version. Risk management, ISO 50001, 2008 version, energy management, ISO 26000, social responsibility. In the Philippines, the most popular ISO standards being sought by organizations, particularly the non-medical enterprises, not the hospital. The most popular is still the ISO 9000, which is on quality management. The second one is ISO 14000, which is on environment management. An organization which has an ISO certification should specify the type. Example, organization X has ISO 9000 certification. This just means it has certification on quality management. And organization Y has ISO 14000 certification, which just means that it has certification on environmental management. It is incomplete when one says an organization is ISO certified. One has to complete the description by specifying the type of certification. The same thing with hospital accreditation. One should not just say the hospital is accredited. One has to specify which standards or which organization which represents a set of standards. In the Philippines, the following accreditation and certification has been sought by hospitals. ISO 9001 or quality management, ISO 14000 environmental management, quality healthcare and patient safety management. There are several here, but the main player here is the Joint Commission International Accreditation. And then number 2 is Accreditation Canada International. PhilHealth Benchbook, the local ones. Philippine Quality Award, this is the National Quality Award on Total Quality Management. Investors in People, this is for the Human Resource Management. So these are the commonly sought after standards in the Philippines. With the various accreditations and certifications being sought for by the hospitals, when one talks of having an accreditation of certification, one should specify the name or the number, especially in ISO. Going back to our topic, what is hospital quality accreditation? I repeat, it is the hospital's voluntary application for recognition or attestation of compliance to certain quality management system standards set up by an external organization to be used as part of the business development program of the hospital. And for the purpose of my lecture this morning, I will be referring to these standards. The ISO 9001 or Quality Management Standards, Quality Management, Philippine Quality Awards, Total Quality Management, Quality Healthcare Patient Safety. Examples will be the Joint Commission International and the Accreditation International Standards and also the local PhilHealth Bench Book. Let's backtrack a little bit. What is quality management system? ISO defines it as a management system that pertains to quality. It's as simple as that, a definition of quality management system. Management system that pertains to quality. But what is quality? Quality is defined by ISO 9001 as the degree to which an object or an entity, example, a product, a process, or service being offered by a by an enterprise like the hospital satisfies a specified set of attributes or requirements. Okay. So the degree to which an object satisfies a certain set of requirements. This is the definition of quality by ISO. This diagram shows the current framework of the ISO 9001-2015 version. I think this still holds true today. It has not been updated, it's not been revised. Quality management system with customer requirements as one of the main inputs and customer satisfaction as one of the main output. So input is here, output is here. Customer satisfaction, okay. Main output, okay. Customer requirements, main input. The throughput uses the plan, do, check, act cycle in the integrated elements of leadership, planning, support and operations, performance evaluations, and improvement. Formulated standards are seen in number 4, the quality management system. So there must be formulations. There are formulated standards here. And then also formulated standards are also seen on the number 5 or all in each of its boxes up to number 10, improvement. Okay? So there are specified standards by ISO in all of these boxes. The Philippine Quality Awards or the Philippine or PQA for short has this total quality management or performance excellence framework. Initially, the PQA has focused on business enterprises, the so-called business criteria for performance excellence in healthcare framework. Okay. Now it has expanded to hospital industry. There is now the so-called PQA, healthcare criteria for performance excellence standards. Actually, this is an adaptation of the Baldrich's healthcare criteria for performance excellence. So in the US, the Baldrige healthcare criteria also started with the business enterprises, and then later on, they came out with the Baldrige healthcare criteria for performance excellence also. Formulated standards to fulfill are seen in number 1, leadership. Number 2, strategic planning. Number 3, customer focus. Number 4, measurement, analysis, and knowledge management. Number 5, workforce focus. Number 6, operations focus. and number 7, results. So you can see some similarities with the ISO 9001 quality management system. Examples of quality healthcare and patient safety management standards that are currently sought for by Philippine hospitals are the following: the PhilHealth Benchbook, Joint Commission International, and the Accreditation Canada International. And comparing the three hospital accreditations or are inherently for hospital accreditation, unlike ISO or in PQA, which started and more inherent in business and manufacturing industries. All these three emphasize quality health care and patient safety. All three have the two major categories of standards, namely patient-centered standards, okay, management of patients, and healthcare organization and management standards. So basically, these are the two categories of standards. In between, the two major categories are different topics or different areas, which can vary, okay, among the three types of three accreditations uh, agencies or the third party giving the accreditation. But basically, they have the patient-centered standards and the healthcare management, organization management standards. Accreditation fees. Hospital accreditation almost entails fees. No such thing as free. There's a fee for the survey or the assessment, and then the fee for the certificate. How much of the fee are will be dependent on the accrediting body. This table, just to give an idea, and this is not really updated. Okay, so these are the fees that are involved. For PhilHealth Benchbook, it has increased to 500,000 as of today. Okay, before it used to be 100,000. Okay, then JCI, Joint Commission International, 75 million or even more to this day. Then Accreditation Canada, 8 million. Philippine Quality Awards for small organizations, 30,000. And then for the bigger organizations, 50,000. For the ISO, the running rate is about 400,000. This is just to give you an idea of the fees. It might change as time goes on. What are the currently sought accreditation by hospitals in the Philippines, advantages and recommendations? For PhilHealth Benchbook, this is the local standards directly related to the Philippine hospitals. I guess in other countries, they also have a local version. So this will be needed for licensure with the Department of Health. So before you get a license from the Department of Health, they usually ask for accreditation by the PhilHealth Benchbook. My personal recommendation, all Philippine hospitals must have for viability and sustainability reasons to have PhilHealth Benchbook. Joint Commission International or an Accreditation Canada, these are international standards, okay? Coming Joint Commission International is based in the US, Accreditation Canada based in Canada. But these two international accrediting bodies or standards are directly related also to the hospitals, and these are recognized internationally and prestigious. And I suppose because of the presence of the two players or even more, other countries have also come out with some accrediting standards. They are competing with each other. So my personal recommendation is to just go for one if the hospital has a medical tourism project. I'm talking about Philippine hospitals. If the Philippine hospital has a medical tourism project and needs leverage with international collaborators and partners. ISO 9001 is an international standards on basic quality management system that are applicable to all kinds of industry, including hospitals and healthcare. My personal recommendations, go for it if an international accreditation is deemed needed and the hospital cannot afford the ACI or JCI, okay, fees. And then for the Philippine Quality Awards, this is the local standards that covers all kinds of industry, and there is a specific set of standards in healthcare now, okay. My personal recommendations, go for it if the hospital wants to have the highest, most prestigious quality award in the Philippines, as this award is usually or is awarded by the President of the Philippines. Let's now go to the objectives of the hospital quality accreditation. The general and overarching objective is that hospital quality accreditations are used for business development programs of hospitals to enhance the reputation so as to attract more patient clients and physician clients to utilize their services, thereby promoting financial viability and sustainability. Hospital quality accreditations are also used in the following: to increase the hospital's credibility and to demonstrate its accountability to the community using an attained hospital accreditation, to increase its leverage with the potential partners and collaborators in the healthcare industry using the attained hospital accreditation, to use the accreditation project as an assessment tool on hospital performance, as well as a change management tool, to identify and institute areas of improvement towards excellence with the help of hospital accreditation project, to educate the staff on performance excellence with the help of hospital accreditation project. As to the structure of the hospital quality accreditation, this can be, the hospital quality accreditation can be looked at as a program or as a project. It can be a temporary or permanent one. My recommendation that it should be on a permanent basis once the hospital administration has decided to go for hospital quality accreditation. For the following reasons. One, the accreditation is usually for a limited time period, renewable, say every 3 years. Two, there is a need to continually train the staff on quality management system and to continually monitor conformance to standards. The hospital administrations can either create a committee or an office for the hospital quality accreditation or program or project, and committee if they will create a committee if the program is short term, and if the program will be long term, it will be they have to create an office. As to the staffing, strictly speaking, staffing of the hospital quality accreditation program involved all staff of the hospital, from top management to rank and file. Everybody's involved, all working in an aligned and integrated fashion towards attainment of the external recognition. To orchestrate or direct the hospital quality accreditation, a committee, as I said, a committee or an office may be created. The staff in this committee or office will be those knowledgeable on hospital accreditation processes and who can teach the rest of the hospital staff on quality management system, particularly on how to fulfill the requirements of the required standards and who have the necessary leadership and managerial skills. Since the hospital quality accreditation project or program is a hospital program and hospital-wide, all staff should be engaged, aligned, coordinating, collaborating, and integrating with each other to promote the success of the program. The steering committee should have a multi-sectoral membership so as to entice involvement, participation of everybody. Cross-sectoral or multi-sectoral membership with representative from key functional areas in the hospital, such as the following: from the medical service sector, nursing service sector, ancillary medical service sector, administrative or support service sector, human resource development sector, business development sector, finance sector, and to put up a secretariat for this. Policies of the hospital quality accreditation. The primordial policy is that once the hospital quality accreditations project or program is set up, all the staff from top to bottom, to rank and file, should all be working in an aligned and integrated fashion towards attainment of the external recognition. The other basic policies should be cover the following. What are the authorized functions and authority of the Hospital Quality Accreditation Committee or Office? And what are the punishment and rewards for non-conformities and excellent conformities, respectively, on established quality management system or standards? As to the system of hospital quality accreditation, this invoke system approach and system thinking. So all departments and services should be involved in the hospital quality accreditation project or program. And all departments and services should be aligned, coordinating, collaborating, and integrating with each other in the hospital quality accreditation project or program so as to ensure attainment of the external recognition or accreditation. And it goes without saying that all the quality management system of all the departments and services should be aligned and integrated also with each other to attain the highest degree of quality. As to the methods of the hospital quality accreditation, the top management decides to have a hospital quality accreditation. Number one, to promote the business development program of the hospital so as to make it viable and sustainable, to use it as a change agent to fast-track quality improvement. And then top management creates a steering committee or team or an office for hospital quality accreditation project with clear functions and authority. Membership of the steering team, as I said, there must be a multi-sectoral membership. Then there is a senior management representative, if not the hospital director. Okay. So this again shows the membership, cross-sectoral membership. The steering team formulates a master plan for hospital quality accreditation and decides on a set of standards to be assessed and evaluated on by an accrediting body. Then it seeks the commitment for support and collaboration from top, senior, middle, and lower management on the hospital quality accreditation project. Before I go to the next prescribed learning outcomes, let me discuss this topic first. The road to hospital quality accreditation, how necessary and who cares? Is it really needed? This is a common question asked particularly by hospital administrators and managers. Is hospital quality accreditation really needed? The general answer is it depends on your need and situation. If there's a need, okay, if there's a need, if there's a need to participate in the national health insurance like the PhilHealth and get the benefits, go for the PhilHealth accreditation. If there's a need to participate in the medical tourism program and get benefits, then go for the international accreditations such as ISO, JCI, and ACI. If there's a need to satisfy the requirements of corporate accounts, go for an accreditation. If there's a need to satisfy the expectations of the community, go for an accreditation. If there is a need to be known as the best hospital with performance excellence, if you want to get the reputation for the best hospital with performance excellence, go for the Philippine Quality Awards. Situation. If there is a situation to be with the trend and having an international accreditation, not to be left out, there's a strong community expectations, go for the accreditation. If there's a situation that you want to fast track improvement of quality and safety of operations and services with accreditation, go for accreditation, which will include assessment, training, improvement, and evaluation. If there is no need or no situation, then just be compliant with the standards and criteria without going for the formal accreditation. I repeat, you don't have to go for the formal accreditation if there's no need and no situation. Just accomplish compliance with a self-directed learning and improvement. This can be done, but it's really quite difficult, but it can be done with a strong leadership and managership. So one can study all the stipulated standards in the different sets of published quality standards, which are readily available in the internet, and come out with an integrated checklist, and then comply through self-directed learning and training and continuous improvement. So all these standards are readily available, so you can take a look and then integrate all of these four, example these four, and then come out with a checklist that will cover everything here, or almost everything, and then try to implement it, okay? Then comply with it, then you may be achieving performance excellence without going for the external accreditation. Okay, so we have covered all the items in the second prescribed learning outcomes. Let's now proceed to the third prescribed learning, which is to develop the ability to pinpoint and isolate management and administrative problems in the hospital quality control system or program and offer relevant solutions. Here I will be sharing with you the common problems which I have encountered and the suggested strategic solutions. I shall categorize the common problems into three phases: pre-hospital quality accreditation phase, so before going for the quality accreditation, hospital quality accreditation phase, and then the post-hospital quality accreditation phase. There are problems that cut across the three phases, meaning problems that are present in the three phases, or problem in the earlier phase, such as in the pre-hospital quality accreditation, that may persist and spill over to the next phase or phases, and problems predominantly present in a particular phase. Here is a list of what I think are the common problems of the hospital in the hospital quality control program. Number one, varying perceptions and definitions of quality of clients and also the hospital and department staff. Number two, establish mindsets and habits of staff from top management to managers and rank and file, where the call for a change for improvement is difficult. Number three, of course, is the cost of accreditation, as accreditation entails cost. Number four, inherent difficulty in developing and institutionalizing a comprehensive, aligned, and integrated quality management system in a hospital. The foremost problem or challenge is the varying perceptions and definitions of quality of clients and also of the hospital and department staff. Patient clients have their own perceptions and definitions of quality. Physicians' clients have their own perceptions and definitions of quality. The staff, or even the managers, have their own perceptions and definitions of quality. To show you that this is the case, in 2010, I made a survey on the perceptions of hospital administrators, physicians, non-physician health professionals, and patients on the parameters of excellence or quality in a hospital. There was a total of 141 respondents. So 34 from the hospital administration, 34 physicians, 39 staff, hospital staff, and 34 from the patients. I got varied responses from one group of respondents to another. Collated responses revealed 58 specific parameters of excellence, which is very many, which can be categorized into 11 categories. The greatest majority of respondents place infrastructure and facilities as number one excellent parameter. Next, the medical equipment and the drugs, and then governance with excellent services as number four, only excellent services. So they have different perceptions of the quality parameters. On the specific parameters, on infrastructure and facilities, there were varied perceptions of quality among the different groups of respondents. Just to cite two examples, a great majority of the non-medical staff put significant weight on modern infrastructure and facilities compared to the medical staff. The hospital administrators, physicians, and non-medical staff put significant weight on complete and well-maintained infrastructure and facilities compared to the patient. On the specific parameters on services, again, there were varied perceptions of quality among the different groups of respondents. Again, to just cite two examples, the physicians and the non-medical staff put significant weight on complete and efficient services compared to patients. The physicians put significant weight on the presence of multi-specialty medical services compared to the non-medical staff and patients. So how do you resolve the varying perceptions and definitions of quality of patients, of quality of the clients, and also of the hospital staff and department staff? A suggested strategic solution, the hospital should look at the perceptions and definitions of quality of the perceptions and definitions of quality by the clients, both the patient and also the physician clients, and try to meet their requirements as indicated and as appropriate. In ISO quality management system, the starting point are always the determination of the customer requirements and needs and expectations of relevant interested party. So in PQA, the customer focus requires the organization of the hospital to determine the requirements, expectations, and preferences of the customers. So in the PQA, there are three items here in the standards of customer focus. You have to listen to the voice of the customers, okay? Listening to the customers, and then listening to the current as well as potential customers. So in reality or real practice, it is extremely difficult to get uniformity on the needs of the patient clients as well as the physician clients, as they always have varying perceptions, definitions, and mindsets. Thus, to support this search for customers or clients' needs, a suggested The strategic solution is to look for the current standards of quality in a hospital management abroad and also at home and adjust accordingly and use this to management the expectation of the patient clients and physician clients through education and to change their mindset if they're not aligned with the international or conventional definition perceptions of quality. So one strategy is to educate the public or the people, okay, and try to change their mindset to conform to the usual definition of quality. The second most common problem or challenge is the established mindsets and habits of staff from top management to managers to rank and file, where the call for a change for improvement is difficult. Common contributing mindsets are, if it ain't broke, don't fix it anymore. And then don't disturb our current comfort zone. So these are the common mindsets. This situation is particularly true where the hospital is currently financially stable, regardless of the status of its quality management system, and the owners and leaders are not wary of the threats to financial sustainability from other competing hospitals. These hospitals tend to preserve the status quo without continually improving their quality management system, and more so without going for hospital accreditation project, particularly when cost of the accreditation is considered or factored in. For this problem or challenge on established mindsets and habits of the complacency and without putting utmost importance to hospital quality program, improvement or change in the governance and leadership direction is crucial. The leaders and owners should first realize the importance of an excellent hospital control program in promoting financial sustainability. After realizing this and subscribing to this, they should take the lead, convince, and educate all their staff to pursue an excellent quality management system with or without. As I said, you can go without accreditation, you can still achieve a quality performance through your quality self-directed training and learning of the quality standards. The cost of the hospital quality accreditation is a common and realistic challenge. As I said, accreditation entails costs. So here, take a look again. Okay. So remember, this table just shows the cost of the initial accreditation. When you maintain the accreditation, usually every 3 years, there's another cost to that. My suggested strategic solution is to look objectively for the indications for a hospital quality accreditation. One may not need a hospital accreditation if one can do self-directed learning, training, and improvement. Or one can just choose one that will cover everything. You don't have to go for multiple accreditation projects if it's not really needed. So remember these slides that I presented earlier. If there is no need, no situation indications, just be compliant with the standards and criteria through self-directed learning and improvement. Again, remember this slide on there is a need indication. This slide on the situation indication. The most challenging problem in hospital quality control program after decision to establish, develop, and institutionalize a hospital quality management system is the quality management system itself. It is not easy. It is inherently difficult. It is extremely difficult, especially if one is to develop and institutionalize a total quality management system involving the whole hospital and involving the whole staff with varying healthcare professionals and non-healthcare support staff, and where alignment and integration are the key result areas and performance indicators. The challenge starts with formulation of the blueprint of the quality management system in its department and service, including the governance body and board of directors. Then the challenge is to make this quality management system of all the departments and services aligned and integrated with each other. Then the implementation, where there must be demonstration of aligned and integrated behaviors and activities of the staff. Then monitoring for conformities and non-conformities. And then lastly, a formal evaluation of the quality management system at planned intervals, say yearly, with formulation and implementation of continual improvement program. So you can see the challenges in the process of quality management system. That's why I said it's not easy. Challenges and implementation, all the staff from top management to middle managers and rank and files should be engaged. They should be committed and trained also in the formulation of blueprints, implementations, and evaluations, and continual improvement of the quality management system. All staff from the top management to middle managers and rank and files should be constantly aligned, coordinating, and collaborating, integrating with each other in accomplishing the total quality management system. The usual findings in hospitals based on experience is the so-called Nina's Kugon mentality. So the other findings in the hospitals are incomplete, incomprehensive, not aligned, and not integrated, hiding non-conformities to stipulated policies and procedures by the hospitals. In those for surveillance visit, after the initial accreditation, staff will work double time to ensure passing by covering up on non-conformities and catching up on fulfilling requirements of the standards rather than doing them on a daily routine basis. So this is a tall order. It needs strong leadership and extensive training. Before we end this section, here again is the list of the common problems that I have observed in the hospital quality accreditation. Varying perceptions and definitions of quality of clients and hospital and also the department of staff and department staff, established mindsets and habits of staff, where the call for change is difficult, change for improvement, cost of accreditation, inherent difficulty in developing and institutionalizing a comprehensive, aligned, and integrated quality management system in a hospital. We now go to the prescribed learning outcome. The fourth one, number 4, draft a hospital quality management system framework pattern after ISO 9001-2015 framework, which is still existing, okay, that can be used as a guide for developing a hospital-wide operations manual. This is the ISO 9001-2015 Quality Management System Framework, which can be used as a guide or the starting point to draft the quality management system of the entire hospital. One has has to put in the descriptions, elements, and preferably a management system in each of the boxes. This is just a conversion of the original of this one. Okay. I just simplify it with this illustration. So one has just put in the description of example in the leadership description here, okay, and the management system here. Okay, so there are about 10 boxes here. For each box, there must be a description. Okay, what are these? What are the purpose? What are the policies? One can read the stipulated standards of PhilHealth Benchbook, JCI, ACI, or PQA as a guide and integrate and incorporate them into the ISO standards or boxes as applicable. So with the ISO as the foundation, you just read the standards stipulated in PhilHealth Benchbook, ACI, JCI, PQA, and then what anything that are relevant to this particular box, you just put in inside here this box. This is an example of an adapted framework from ISO 9001-2015. It can be used as a hospital governance and operations manual as well as quality management system. The quality and safety management system is used instead of just quality management system to meet the requirements of PhilHealth Benchbook, JCI, and ACI. So instead of just creating another hospital quality and safety management system just to use it for external accreditation, you can make these two the same thing. Okay? So the hospital governance and operations manual can also integrate or include this hospital quality management system. It doesn't have to be two manuals. As mentioned earlier, one has just to put in the description, elements, and preferably a management system in each of the boxes guided by and compliant with established standards in the ISO, PhilHealth, JCI, ACI, and PQA. So once done, the whole manual shall be the hospital manual for quality and safety management system, and at the same time, it can serve as the hospital manual governance and operations. So here this is an illustration of you be guided by the compliance with established standards and then come out with management system for all these boxes. Preferably, there must be a write-up on each box and standards in the format of a management system. Example, in the ISO, so here in the ISO, you have the client requirements. Okay. So you can come out with the client requirements management system, the legal requirements management system, leadership management system. So I said all the boxes should have a formulated, written, okay, documented improvement management system, should be reviewed, implemented, and then continually improved. So these are the management system that will be examined by the external accrediting body. So here is an sample template in writing the management system with its standard with the following contents. With the title, the concepts and meanings and definition of scope, especially the operational definitions of the management system, then the rationale and the purpose, the policies, the procedures, work instructions. Work instructions are more specific compared to the procedures. Then policies on review of policies, procedures, and work instructions. And then a formulation of a statement on non-adherence to established policies, procedures, and work instructions. And then with a notation on the document number, version, date, release, prepared, and approved by whom. So this is a sample of a template on writing the management system in each of the standards, in each of the boxes. So to end my presentation, I will flash again the prescribed learning outcomes and objectives, which I have covered. Number one, understand the importance and value of adhering to quality control standards when it comes to managing the hospital and its different departments and services. So basically, to attract patient and physician clients to the hospital to utilize their services, thereby, as part of this is part of the business development program, thereby improving the financials, viability, and sustainability. Number two, I have discussed the philosophy, objectives, structure, staffing, policies, systems, and methods of hospital quality accreditation. Number three, ability to pinpoint and isolate management and administrative problems. Then number four, drafting a recommendations on drafting a hospital quality management system framework pattern after ISO 9001, 2015 that can be used as a guide, both for developing the hospital-wide governance and operations manual. I really hope I have, or you have acquired I've discussed and you have acquired the prescribed learning outcomes through my presentations. This is the last slides. Thank you for your kind attention.
Okay, thank you very much. If anybody in the class has a question for Dr. Hoson, you can use the raise hand reaction. Yes, Dr. Shafiq, you may ask your question.
Very good afternoon to Prof. Patrick and
Can you open your camera, please? Thank you.
yes, hold on, coming. Okay, very good afternoon to Prof. Patrick and Prof. Ray Hosnon. I have one question to ask. When you talk about accreditation, in an institution, how long do you think the preparation is needed for an institution to get ready prior to go for an accreditation? I mean, you said yes, there is a problem from the human resource area, clinical area, your other factors that support the whole organization. So, as adequate time that required to prepare for the accreditation, how long do you think is the time needed to prepare?
Okay. So the quickest answer here is it all depends. It all depends on the current situations of your quality management system, even without accreditation. If it's remember the diagram that I showed you last time. You are in the reacting phase, then there's some semblance of a alignment already, then integration. If you're still in the reacting phase, probably it will take more time. No, okay. So it all depends. But from personal experience, no, probably 1 year will be sufficient. But don't expect to have a perfect score. Okay, perfect accreditation. Okay. The thing is, if you just a lot of this if you're talking about external accrediting body, right?
Yes,
Going,
Prof.
okay. A lot of times is external accrediting body will give you a chance to get accredited. Okay. So they might give you the lowest level, no, then ask you to improve further. At least you get a certification certificate already. Okay. Then you can go in some let's say in JCI there are three ACI there are there are three categories. You have the platinum, the gold, or the what's the one? Diamond, no? So you may be ended you might end up with the lowest first. That's good. That's good enough, no? Then you're given a chance to improve and improve, no? At least you have an accreditation to boast of, to market it already, no? Okay.
Okay, Prof. Thank you.
Is it
Okay,
possible for you to do your accreditation in 6 months?
It's a tricky question. It's a tough question, but I don't think so. I mean, I still agree with you. You need some time to align the whole organization and they are on same page or they're on the same track before we go for an accreditation. If your whole organization or one, 2 person who still, they are not in line or on track with you towards the accreditation, therefore, I think the enforcement for the particular individual or department to have a mindset of the importance of accreditation, and then you will have in the same page prior going for the accreditation.
Yeah. Okay. Don't forget the leadership. You need a very strong leader there. No? Okay.
Thank you,
Thank
Prof.
you.
okay, Dr. Balan, please ask your question.
Very good morning,
Good
Prof.
morning. Good morning.
Um, it's just with regards to we just had a mock survey by an external accrediting body by Malaysian Society of Quality of Health, and I don't know as an administrator, would you take comments from the surveyors or the auditors if it's not based by the guidelines or by the books? Would you be
Pardon?
op would you be open to their comments or their findings if it was not mentioned in the books? Meaning, what I'm saying is, if I'm an administrator, I would definitely go by what's mentioned in the books. If the auditing process and the findings are by the books. But do you think it's also important to take in information with regards to findings which are not relevant mentioned in the books?
Yes and no. Yes,
If the choice was left to you, Prof, what would you do?
it all depends on what the external surveyors are telling you. If you think it makes sense, although it's not in the book, no, and then if you need to have their approval to get accreditation, you just compromise and settle for it, no? Okay, but if you really think that it's not appropriate, then you can discuss it with them, no? Okay, in a
Because we
diplomatic
realize
way.
that because we realize that, Prof, each surveyor has their own opinion about things.
Yeah,
So
that's
it's
true.
very difficult that, if we have, say, 10 surveyors and we have three mock surveys, and if we're going to listen to every comment and take that seriously, it's going to be very confusing and it's going to be quite contradicting in many ways.
That's true.
So we decided as an organization that if we were going to probably, um, you know, make amendments, then it should be whatever that's mentioned by the book.
Yeah, that could be. But is that accrediting body a national body?
Yes, it's a national body.
That's a national government body.
Yes, yes.
Okay. So you need the accreditation.
Yes, we were given by the Ministry of Health to get ourselves accredited, and we are a 5,000 staff hospital, so it's not going to be easy if you're going to do it in the next 6 months.
Yeah, if by listening to them, you can assure of an accreditation. Go for it.
Mm. Okay, all right, Prof.
Okay.
Thank you.
It all depends on the situation. Okay. So it really, and it all, as you said, you're correct. No, a lot of surveyors have different interpretations. No, okay. So I'll tell you one story. Okay, I saw, as I said, started with the business industries. No? And then when they survey the hospital, they don't have an idea of the hospital operations. Okay, so they come out with different ideas, recommendations. But in the Philippines, since the mindset of all the non-doctor surveyors, they respect the doctors, the hospitals. They just agree with what the doctors will be saying. Okay. And in the end, as I said, the trick there is just to listen to them and just get the accreditation. Then after that, you can just modify it a bit. No? Okay. Okay.
Thank you, Prof.
Okay. Any other question from the class? Oh, yes, Dr. Shafiq, you have a follow-up question.
Hi,
Shafiq.
Prof. Sorry,
Hi.
just another question would like to ask.
Sure.
Regards to accreditation, mainly as you said, you have your ISO, you have your Philippines accreditation, you have your GCI. Um, my question is, how many accreditation that would you say it's enough for an organization? Would you just go for the Philippines accreditation, or do you think nope, you need an international standard one, or do you think it's best to just have both? As each accreditation has its own tech spec that um, you need to follow. So therefore, what's your opinion on this accreditation? Should you take both, or it's okay to have only one?
Yeah, the minimum is one. If there's, as I said, just like in the Philippines, no, practically all hospitals have no choice but to go for the PhilHealth bench book, no, because all the patients with under the Philippine health insurance now will be utilizing the local hospitals. So somehow the local hospitals will benefit from the revenue that they will get from the members of the Philippine healthcare insurance. No? So in Malaysia, I think you also have that system. No, you have the local Ministry of Health requiring you to have a minimum standards. So go for it. No? Now, but if you have, as I said, if you're catering to international tourism, then you go for JCI. I think that's more popular now, JCI, than Accreditation Canada. No? The reason why we have Accreditation Canada here is that the differences in the expenses are quite big. No? Okay, so some would go for the Accreditation Canada. It's the expenses are uh, probably acceptable. No? Okay, so so it all depends on the, but I think the minimum will be to go for the nationally required standards. No? Okay.
Thank you, Prof.
There is someone in chat. Dr. Teo, do you want to ask your question in person? Oh, sorry, it's not a question. You just want to share. Okay.
Okay.
So from Dr. Teo, just to share, for government hospitals in Malaysia, we are moving towards accreditation by Malaysian Accreditation Organization for Healthcare Facilities and Services. So MSQH. Okay.
Okay. May I ask how have you examined the standards and how different are they with the JCI? I suppose some of your hospitals are accredited with JCI, Joint Commission International, right?
Good morning, Paul. I wish to answer that
Okay.
question. Okay. MSQH is a standard where it is adapt. Okay, we have a body which is called standard in Malaysia. So this body will actually create standards for MSQH, and the certificating body for MSQH is called ISQA. It is an international standards for quality. I think that is the abbreviation for ISQA. So they will monitor the standards of MSQH. So MSQH will have for every section we have like 7 core standards and subsequent standards, support standards, all the standards that needs to be observed. So the auditors will come from MSQH to audit the hospital on all these standards. Yeah.
Okay, so you have another third party there, no? Aside from
It's a
MS,
non-governmental body.
yeah, the ISQA.
Yes, they
The
are the
ISQA.
third party, correct.
Okay, so that's good, no? So the ISQA will uh, will probably evaluate the local surveyors from the MSQH and see if they are really qualified to do the assessment, right? Okay. So so I would suppose since ISQA has also a standards, usually practically all the standards, international standards on healthcare facilities and services, or we call that the patient safety management system, no? Okay. So they usually have two categories, the patient-centered standards and also the organization standards, right? Okay. So, so most likely the MSQH, when they come out with the standards, they will have it checked by the ISQA, right? Okay, right? Sibalbalan.
Yes, Prof.
Okay. So they will have it checked by the validated by the ISQA, right?
Yes, correct,
So
Prof.
so most likely the standards will be more or less the same as
The
Commission
JCI.
International, ACI. No?
Correct.
Okay. So some probably will be more stringent, some will be less stringent. No?
Yeah.
Okay.
Correct.
Okay.
Correct, bro.
Thank you.
Okay, so Dr. Teo, was your question already answered, or do you want to ask your question still or recontextualize? Oh, okay, so it's already been answered. Okay, all right. So, any other questions from the class? Please don't forget to answer the Olete. I'll give you the a deadline of Thursday. Okay, so by Thursday, everybody should have answered the Olete. Okay, so that Dr. Hoson can evaluate. Okay. Any other questions? Going once, going twice. Okay, so with that, uh, let's take a picture. I know that Dr. Hoson wants wants some
Yeah,
picture
yeah.
from us. So please turn on your cameras. Okay. Would you be the one taking the picture, sir?
Yeah, I can, but you
Okay.
can take a they can also take a picture on the camera.
Of course, of course.
Okay.
It's just that with Windows, I have to set.
Okay. Okay.
Okay. All right. All
So
right.
show your
So
beautiful faces. Okay. One, two, three. Okay.
okay, thank you very much, everybody, for attending. Thank you very much, Dr. Hoson, again, for gracing us with your presence. We will have another session with you next week on management of the Department of Surgery. Okay,
Okay.
so we
Okay.
will see you again, and everybody take care until, well, not until next week, but take care always. Okay, so bye
Okay.
Thank
bye.
you. Bye.
Bye-bye.
Thank you.
Bye.
Thank you. Bye.
Thank you,